Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Treatment of ureteral injuries. If there is any ureteral injuries during surgery, then first we should see early repair is recommended, especially if the patient is fit for surgery. We can do early repair. Now, in the early repair, if the injury is recognized at the time of surgery, then we can do number one, ureterovesical continuity should be restored. That means both the parts of the ureter, they should be continuity should be restored. Okay, next, if the patient is not fit for surgery, there are two things. If patient is fit for surgery, immediately after diagnosing the injury, we can directly do a ureterovesical repair, ureteric repair, or we have surgeries. Based on that, we should make sure that the continuity between the ureter and the bladder is restored. But if the patient is not fit for surgery, then we will have to ligate this end of the ureter. This um, proximal end of the ureter is ligated, and then you should put a percutaneous nephrostomy is put, and later after some time you can do delayed anastomosis is done in this case later. Second, now
thank you and thank you for watching.